Well friends, good morning and welcome to my new video. Today I am going to discuss with you a case which I saw in 1990s. It was early 1990s when I received a telephone call from the Kanishka Hotel on Ashoka Road in the capital of India, New Delhi. Kanishka Hotel has been demolished and now a new structure has come in its place. When I reached Kanishka Hotel, I confronted a tall, well-built American who was a lawyer by profession. He and his wife had come to India for sightseeing. The patient I am referring to was not obese. He was thin built. He was apparently normotensive. Suddenly he had difficulty in breathing and cough, for which I was called by the Kanishka Hotel staff. It was an emergency, therefore there was no time for detailed examination or investigations, and there was not too much provision for the investigations. Echocardiography was not available at that time. Even X-rays were not available everywhere. I made the patient to lie down to examine. We call it supine position, when the person lies on his back. But the moment he lied on the bed, he got a bout of violent cough and he sit up. In sitting position, his breathing and cough became better. I examined his chest and found bubbling rales on the back of the chest, both right and left side. Rales are crepitations. These are the medical words we use. They mimic like rustling of hair when you hold the hair between your two fingers and rub. Such noises are indicative of fluid in the basal portion of the lungs. So, having known this, I immediately examined his blood pressure. His blood pressure was normal but towards the lower limits. Then I examined the heart. And what did I find? I found a holosystolic or pansystolic murmur in the area of left nipple. This area we described as inframammary area. The murmur was hollow. It was blowing type of murmur. It was sufficiently loud. We usually classify it as between third and fourth grade of systolic murmurs. Pansystolic or holosystolic, what does it mean? It means this murmur starts right from the first sound, goes right up to second sound, and this area, this time interval, this period between the first sound to second sound is called systole or period of contraction of the heart. Systole is usually shorter than the diastole. Diastole is a relaxation of the heart muscle. The diastole extends from the second heart sound right up to the first heart sound, and systole lies between the first sound and second sound. So the murmur I am referring to was occupying the entire portion of contraction of the heart, and that is why we call it pansystolic or holosystolic murmur. Now how it was appearing? I will mimic you by making a sound with my mouth so that you can understand what I was referring to. Like Again, see, now with these sounds, how it will appear? Lub, dub, lub, dub, lub, dub, lub, dub. That is how it was appearing. So I could immediately make out that it is a case of mitral regurgitation. The murmur was going towards the axilla, that is the armpit, and a pan-systolic murmur in the area of cardiac apex, that is the apex, area of apex beat, which radiates to the axilla or armpit and is of blowing type, occurring during sleep, occurs invariably due to mitral regurgitation. I will explain to you with diagram what is the mitral regurgitation and what I am meaning by this thing. Now look at this diagram. I hope you can make out what is this. It is written RA. It is right atrium. Right atrium receives blood by two channels. This is the one channel. This one. This is called superior vena cava. It is marked as SVC, superior vena cava, and this is bringing blood from the head and upper part of the chest and the arms. The other channel is this one, which is called inferior vena cava. This inferior vena cava is marked here as IVC. This is bringing blood from the lower limbs, abdomen to the right atrium. So right atrium, as I explained in my last lecture, there are two collecting chambers of the heart, right atrium and the left atrium. It is marked as LA, left atrium, and this is the right atrium. They collect blood from the various parts of the body, and from there the blood goes to the ventricles. From the right atrium, the blood goes through this opening into the right ventricle. From here, the blood goes into the left ventricle, and this is the left atrium. This portion is the left atrium, and these two channels are two pulmonary veins which are bringing blood from the lungs. It is purified blood. Now from the right ventricle, a big channel arises which goes like this. This is called pulmonary artery. This is called pulmonary artery, and this, at this point, this pulmonary artery divides into two. One goes to the left side, the other goes to the right side. So this is the right pulmonary artery, this is the left pulmonary artery. Now from the left ventricle, a big channel arises. This is called aorta. This channel turns around like this. This is called arch of the aorta. It gives three big arteries which goes to the right side, which goes to the neck, and which goes to the left side. Now if you see in the diagram, the left ventricle has got thicker walls as compared to right ventricle, because left ventricle needs to generate more force and push the blood to the various organs of the body. Now when you look at this diagram, there are various portions of the heart. The portion which lies immediately behind the breastbone, that is facing the front, that is called the anterior wall of the heart. As you move from the anterior wall of the heart, that is the front of the chest, towards the armpit, left armpit, this portion of the heart wall is called a lateral wall. When you go further down, further backwards, you reach the back of the heart. This is called posterior wall of the heart. the portion of the heart which lies on the diaphragm, that is on the stomach, that is called inferior wall of the heart. This portion of the heart wall is the inferior wall of the heart. So damage to the heart muscle can occur in any of these areas. When it occurs the front of the wall muscle, then it is called anterior wall infarction. When it occurs to the back, it is called posterior wall infarction. When it occurs in the lower part, it is called inferior wall infarction. Usually anterior wall infarction is combined with the lateral wall infarction. Then it becomes an extensive area. Now what is happening here, and what was happening in this patient? This left ventricle, see here, the blood has come here. Now the ventricle is contracting. The walls are going like this. All walls are going like this. Every single portion is going like this. So that pressure in this wall rises, and the blood is pushed in this aorta fossa. But because the left ventricle has become dilated, this valve, this opening doesn't close properly during systole. Normally in contraction of the heart, this will close and the blood will go only in this area. But here what has happened is this opening is partially open because of the heart has dilated, and therefore the cusps cannot close the area even if they want to close. Therefore some blood due to this raised pressure goes back right into the left atrium. This is what produces the murmur, and this going back of blood is called regurgitation of blood. So friends, here was a complicated myocardial infarction, an acute anterior wall myocardial infarction with mitral regurgitation. I took an ECG of the patient and confirmed anterior myocardial infarction. I advised the patient to get admitted in a hospital for further advice. He asked me what advice and what I am required to undergo. When I explained him that he will require surgery for repair of the valve, he refused to undergo this thing. He said that he will go back to America and get the surgery done there. I did not insist because it could be dangerous, but as a doctor looking after the patient, it was my duty to help him. So with the help of the American High Commission, I transported him back to United States. So friends, these are the type of problems we face in emergency. Always remember that there is no time for any detailed investigation. One has to look at the relevant thing and take quick decisions. I gave this patient injection Lasix, which is furosemide, which is a diuretic, 3 ampoules, 60 milligram intravenously. It is a very quick acting diuretic. It has got an action of dilating the veins and venules. This action starts within 2 minutes, whereas diuretic action takes little time. But this dilatation of veins does help the patient. It did help my patient also. So my patient felt better and was thankful to me while leaving India. Friends, thank you very much. I will be discussing some similar interesting case next time.